Hi, I'm Paula Costa. I'm an associate at Surgewise Consulting, and thanks for viewing my presentation over how residency applicants react when they are invited to complete screening assessments. As I mentioned, I'm a member of Surgewise, which provides surgery training programs with the knowledge, structure, and assessment solutions needed to identify best fit candidates in a fair, equitable, and scientific manner. Using assessments to select residents or fellows is important because it can help enhance resident fit and performance while increasing the efficiency of the selection process. The assessment tools most commonly used, however, such as the USMLE, are inadequate when used on their own. While it might predict later performance on written exams, it is not informative about other competencies, such as clinical skills or professionalism, that are also required to be a successful resident. Many programs worry that using extra assessments could deter competitive candidates from applying. While research in other fields suggests it should not, this has not yet been examined in surgery contexts. Thus, this study aimed to examine how applicants to surgery training programs perceive screening assessments. We surveyed 1,492 applicants to one of 7 general surgery programs across the United States during the 2018-2019 selection cycle. In the fall of 2018, the applicants were invited to complete SJT items and applicant preferences inventories as part of their application packet. 97% of the applicants did so, and on average it took them 34 minutes to complete the assessments. About 3 months after the match, all applicants were invited to complete a survey regarding their perceptions of the assessments, perceptions of the programs that use the assessments, and how the assessment affected their rankings of programs. 317 applicants completed the survey, leading to a response rate of 21%. The results of the study found that applicants generally had a positive view of the assessment. The majority of applicants agreed that the survey met expectations for assessing relevant competencies, was appropriate for informing selection decisions, was administered fairly, and provided an opportunity for applicants to demonstrate skills not captured in their application. Analyses also showed that applicants who did well on the assessment and were invited to interview were more likely to agree with all items except administration fairness than applicants who were not invited to interview. Applicants also had generally positive views about the programs that use the assessment. The majority held at least neutral views about the programs, and for some students, using the assessment improved impressions of the program such that they would be more likely to recommend the program to others, and thought the program was more likely to care about the applicant, was more thoughtful in their screening process, and was more likely to put time and effort into a trainee's well-being. Once again, applicants who were invited to interview had more positive impressions about the program than applicants that were not invited. Importantly, use of the assessment did not affect program rankings for both applicants who were invited to interview and those who were not. This study shows that applicants are willing to take additional assessments. 97% of applicants who were invited to complete the assessments did so, and there was essentially no test abandonment. In addition, most applicants do not react negatively to assessments. In fact, the results of our survey show that most of the applicants held neutral to positive views about the assessment, although this was dependent on whether the applicant had been invited to interview or not. Thus, programs can feel secure that adding assessments to the residency selection process will benefit them by allowing them to capture more competencies that influence resident performance without deterring individuals from applying. Thank you for your time.